Thank you. It's great to be here. And I think some of you were in the lecture I gave you. Was it yesterday? Yeah. And this is a follow-up. And I'm a bit intimidated because I haven't given this lecture before. And I kind of thought about it quite a bit. In fact, I was working on it until about half an hour ago. So let's see how it goes. And because Jodie reminded me of that health in all policies, when I talk about changing systems, I'm talking about changing everything for a sustainable future, but with a little bit of bias towards health systems. So I'm going to talk about three things. One is, what do we mean by systems change, which is a real relevance to lots of public health. Second, what do we mean about leverage points within a theory of change? All that sounds good. And thirdly, I'm going to talk about something you've probably not heard of, how sympathy groups might tackle climate change and sustainable development. So there you go. And just to remind those that weren't here yesterday, so we've got this thin ribbon of atmosphere which we're steadily polluting with carbon. And when I was born, it was 0.3% in the physics textbooks, CO2 in the atmosphere, and now it's 0.4%. And in about 30 years' time or less, it will be 0.5%. So this is serious change. And I think we'll all agree from everything that you look at in the papers and journals that we face an existential threat. And I showed this figure yesterday, which I always show because I think it's really important, which suggests that on the bottom axis is Human Development Index. So you want all the countries like India, China, and others, what they've been doing for the past 30 years is going in the right direction. Okay, so generally Human Development Index has improved, although there's still a lot to be done in many countries. But the big problem is that as we become more developed, our ecological footprint way exceeds what we should have per head. And the big problem now is to go green. And that's why we've got the Sustainable Development Goals and why health should be in all sustainable policies. And yes.
Who's that friendly little red circle that's in the good box?
Yes. Actually, that's a question I normally ask. So I'll ask it to you and I'll offer money prizes. Look, I've got, what are these? Are they dollars? They're quarters.
Sweden. Cuba.
Who said Cuba? Have you heard me talk before?
Nope.
You guessed.
I did.
It is Cuba. I don't think it's going to stay Cuba for very long because I suspect as their new policies, but nonetheless, you are right. Thank you for that. And do interrupt at any time, I don't mind. And then I showed this slide, which was the director of the Antarctic Survey showed, which basically made me think I didn't need to feel guilty about pretending to be involved in climate change, because it shows that it affects everything. This warming of the planet is going to affect everything, and that means health. And I am vaguely involved in my work in biosphere humanity, so I think we should not apologize. There's no such thing as a climate expert. We're all experts, or we should all be experts in some aspect of this. And certainly having worked in a lot of poor populations like this group in East India, it's complex. Life is complex, poverty is complex, and there are lots of factors that you have to put into any thinking about what's going to work and be sustainable. So in a sense, it's a big challenge, and thinking about how climate change will impact on people like this is very important. I've just put in this, equity and evidence. Christopher Hitchens, I'm sure you used to quite like Christopher Hitchens on, I've forgotten which program he used to be on a lot, but he was a contrarian, and he said that which can be asserted without evidence can be dismissed without evidence. So I'm very much from the evidence-based medicine brigade. As Deming, the great statistician who revolutionized management after the Second World War, said without data You're just another person with an opinion. And I like this tweet from a Nepali guy. The idea that the solution to an economic, political, social, or humanitarian problem is to build a website. And this is to take on, I'm not against technology or apps or websites or anything. I think it's great. But there is this idea that technology fixes everything and not stuff that is social and political. And so I'm trying to be subversive. I'm trying to stir you up to a revolution, which I'm sure you're all taking part in right now as I speak. And of course, in the next few days, we're going to have work on clinicians and engineers looking at ways in which we can look at sustainability within healthcare and these kinds of things. Questions like how you can get people to turn off lights, how you can have eliminate redundant energy use in theatres, energy services, quite complex issues, which is getting down to the nitty-gritty. And I'm not going to talk about that today. So we said about wicked problems. I'm sure you've heard about this. The term was coined by some planners, Rittel and Weber, was it, in 1973. Difficult or impossible to solve because of incomplete, contradictory, changing requirements and interdependencies, and that we've got a super wicked problem on our hands because with climate change, time is running out. There is no central authority for the planet. Those seeking to solve the problem are causing it, and some of our leaders are not seeking to solve the problem, and policies discount the future irrationally. They say, well, we don't need to worry about 80 years hence, when actually we do. Now, we must talk about power, because whatever we do to change a system involves changing the locus of power. Power is everywhere. It's in our personal and family relationships, as we well know, when we have arguments at home. It's in the hierarchies. I discovered this in WHO, that actually it's quite a hierarchical and doctor-driven. It's almost like the World Medical Organization rather than the World Health Organization. And I needed to defend non-medics within my department from actually overt discrimination from certain quarters. This is the British class system that is alive and well. I am not a monarchist. I do quite like Meghan Markle, but I'm not a monarchist. This is the Nepali and Indian caste system at work. In Nepal, all prime ministers from whichever group they come from, Maoist Congress, United Marxist-Leninists, they're all Brahmins. So they all come from an elite, only 13% of the population. You do have an elite system in the United States. I know you're much more egalitarian, but the reality is, we won't talk about that. And here is a meeting in a very important place, the White House, to discuss women's reproductive rights. And I think there are some errors there which may need to be addressed. And you mustn't be afraid to take this on. And everybody was crying after the election in Geneva for about 3 weeks. And one of the persons I work with closely went to Paris, where she is leading what she calls the resistance. She's an American, of course, but anyway. I'm just going to say a word about WHO, because WHO is our kind of global referee and regulator, and I've just been working there for 3 years, so this is WHO. I like to think of myself as a WHO goodwill ambassador, replacing Robert Mugabe, who unfortunately is no longer available. Actually, the day I got to WHO, I met this guy on the left, Andrew Castles, who's British and who had recently retired, and he was sitting in the coffee area. And I walked in, and he said, Tony, really nice to see you again. He said, do you know how many people work at WHO? And I said, no, Andrew. He said, about half. I thought, oh, my God, what have I let myself in for? You know, another bureaucracy. And of course, everyone talks about WHO in that light. In fact, certainly in my department, I found people who were passionate, who were incredibly hardworking, and it was ridiculously under-resourced. And I've got another talk about that, but I'm not going to go into that today. But WHO is important. It was important because it's your global health insurance, to a certain extent, against things like Ebola and Zika. That's the woman, the pediatric neurologist, Vanessa van der Linden, who usually would see one case of microcephaly a month. And she and her mother, who's also a neurologist, saw 8 cases in a day. And then she very quickly, within a couple of days, worked out that this could be related to a new infection and that it was Zika virus. So a very clever clinician. She's really brilliant. I went to visit her rehabilitation clinics in Recife, and she is totally amazing, but worked off her feet. You know, a lot of these places have like 2 neurologists for 3 million people. So anyway, the other thing about WHO is the soft power. If you want to have a meeting, the beauty of it was we would say, oh, we better have a meeting on this. So we would just make a list of all the world's experts, and you send out an invite letter, and they all come. Everybody comes. You know, no, I can't make my wife's birthday. I've got to go to WHO, you know. And it's great. You get, that was a meeting about early childhood development in the picture, which brought together, and there's a big new initiative on that. This is a meeting that the Japanese funded, which was around home-based records. But that's very important, because if you can bring the world's experts in, because WHO doesn't have the resources to do this, its job is to facilitate that. And so if you get invited to WHO, do go. It's quite interesting and quite fun. And this is the World Health Assembly. Now, if any of you are aspiring to be, you know, health policy people, I'd never been to the World Health Assembly until I joined WHO. But you can go if you're part of an organisation. I think, aren't you part of the Physicians for Terrorism Against the World or something? For Physicians for Social Responsibility. Then you just form a group and you write to them and you say, we are Yale physicians and we want to come. In fact, if you register, you could even speak in the assembly, because after they've done all the countries, you get 2-minute slots. You can actually make a statement in certain things. It's fascinating. So this is a side event meeting, lots of young people from different organizations talking about human rights. And now I must tell you this. So this is power, all right, red in tooth and claw. So WHO came up with a strategy for ending childhood obesity, which is a massive worry at the moment. And normally you put a resolution up and everyone has to endorse it. It has to be unanimous. So we go into this big meeting, and I was obviously interested in this. And then the chairman said, well, we need to go into a side room because there'd been some concerns expressed about the language of the statement. So we went into another room for 4 hours, and about 20 countries stood up and said, we love this strategy, we totally endorse it, we're really worried about childhood obesity. And then a certain country, which shall remain nameless, oh dear, I seem to have given the game away, said, no, we're really sorry, we can't endorse it in the current status. And they were the only country out of 194. And we argued, and they changed all the words around, and you could see them looking very uncomfortable, but they were under orders from Washington, and they would not endorse it. And the reason is this, that part of the strategy is legislation and taxation, the idea of introducing taxes on sugar-sweetened beverages. The 26 countries have done it, the UK is about to do it. But historically, the US has never liked to have anything in an international forum that will in any way push their government to have to introduce certain things like taxation. And so they did not endorse, and the child health obesity strategy for the whole world was not endorsed.
And it had to be unanimous?
Yeah, it has to be unanimous. So I'm the director for MCA, and they said, would you mind summing up at the end, you see? So in the main thing. So I saw my opportunity, because I noted that the Director General had gone off for a pee or for a cup of tea. So I whizzed over to get my selfie as Director General. And so I made a lot of statements about the session and, of course, made some remarks about a certain country not, endorsing it, blah, blah, blah. And at the end, a guy comes up to me, American, and said, Dr. Costello, we didn't really appreciate your comments. And frankly, with your posh British accent, we found it a little patronizing. And I said, well, actually, it's pronounced patronizing. and it means speaking down to people. He said, actually, that last bit's not true. It's just a good gag. But it brought home to me that power and politics, in fact, the year before, we'd put a resolution up about promotion of follow-on formula milks, because we want to block, them promoting milks in all of that. And the Americans blocked it, but so did all the European Union and the New Zealanders. And this was under the Obama government. And they blocked it because of trade interests. The dairy product had all nobbled their people and blocked a WHO endorsement. So that's what you're up against, and you're seeing this very up close and personal. It's fascinating. And I think we need more voices who go and speak truth to power, because often it's all the countries are all terribly diplomatic, but the NGOs at the end really jump in. Right, just so I'm not seen as anti-American, I want to say there are 3 central bankers there who control the world economy: Janet Yellen, Mario Draghi, and Mark, whatever his name is, of UK. And the Americans decide economic policy at the Fed on the basis of 2 broad indicators: inflation and unemployment rates. In Europe, we only do it on inflation rates. And the consequence of that has been a public health catastrophe. Those are unemployment figures, youth unemployment figures for southern European states based on a Euro policy that was in Germany's interest. I don't want to sound too anti-German here, but I think their economic policy and the damage it did to Greece, Spain, Italy, and it's still ongoing. So we've had 10 years in some countries of 50% youth unemployment. The states would never accept that. And so I think your policy about stimulating your economy at the first sign of dips in unemployment is much better than Europeans. And so I always remind Europeans of that when they start slagging off your health system. And I must say, as I've got older, you have to think much more about economics. You have to read about economics, think about it, try and work out what's going on. We had the biggest Ponzi scheme in history wreck the world financial system. Utter corruption, no one's paid the price. Don't get me on that. Right. Now, we've had climate denial, the quantum theory of climate denial, which looks bad. It's either not happening, which was the case 10 years ago when we did our first commission. Half of people were saying, oh, it's not happening, it's not happening. Then it's, well, it's happening a bit, but it's not us. It's just, that's the Scott Pruitt view. Sorry, am I being, will the CIA come in and arrest me when okay. It's happening and it's us, but it's not that bad. I think it's good that we've moved it along that level, because we're not far from people realizing it's happening, it's us, and it is bad, okay, which I think it is, but we're getting there. So it takes time. So we've got to think about how we change the behavior and minds of billions of people and produce some kind of revolution if we're going to get on top of this problem, which is not an easy thing to do. So I had to think, what can I persuade you of things that you might do that could have some kind of impact? And I wanted to think about leverage points. Systems analysts talk about this, places within a complex system where a small shift in one thing can produce big changes in everything, okay? So I've been reading about this, and when you do complex interventions, so I've done about 14 trials I've been involved with where you do cluster randomized trials of social interventions. So it's quite complex, and the social scientists say you need a theory of change. Your intervention is there, let's say it's a women's group. What impacts will that have on their knowledge, their behavior, their cash, you come up with a theory of change in order to achieve your effect, which might be improvements in survival or nutrition. And it's a good discipline to do, and it takes time. So I thought, I haven't got any time on this. Is there a theory of change we could use to change the entire world system? Now, I discovered this woman, Donella Meadows. She died at 61. She was an American biophysicist. She wrote a very important document with others called Limits to Growth in 1972, which became a very powerful discussion document about not having endless growth to solve the world's problems. And she came up with 12 places to intervene in a system. And I'm going to go through examples of each of those. Now, she's done it in increasing order of effectiveness. So you've got 12 is you can do stuff, but it's going to be less effective than all the way down to number 1, but number 1 is very difficult. And I've chosen in red a bunch of things I'm going to say, and I'm going to whiz through this fairly quickly. And I hope for you guys who are the future, it's going to spark some ideas about areas in which you could get, because there's an awful lot that you could do, and not all of you are going to do the same thing, okay? So let's see how this goes. So 12, we have carbon taxes and subsidies. Now, economists would say this is the way you solve the problem. You need to transfer tax from good things like income to bad things like carbon, okay? And this is President Macron, who has suddenly decided this is a big thing. And he's right. I think shifting from taxing goods to bads is a very good thing to do. But this is the reality, that we've known about this for 20 years. And generally speaking, carbon pricing in markets, either through what's called cap and trade, so you say this is the limit of emissions for a country, and companies will fight amongst themselves. So if they want to emit more than they're really allowed, they have to buy them from other people. That's what the company's like. But there are other systems for taxing where you would tax people and say, and this is the mistake, when you say about carbon taxes, everyone goes, God, taxes, we hate taxes. But what you should say is, we're going to cut your income tax. No, we're not. We're going to slash your income tax. You're paying how much? 30%? 30% in the US? We're going to cut your income tax to 10%. How would you like that? People say, that's fantastic. And then you say, well, then we're going to put taxes on things that emit carbon, like travel. So instead of me flying here for whatever it was, economy class, $600, it's $6,000. And so people that have to, now then you would need to protect the poor, because you would have to be progressive about people in rural areas and, anyway. So that's carbon taxes, but they're not happening. And this is interesting because two very eminent Republicans, you won't remember them because you're all too young, but James Baker and George Shultz were in the first Bush administration, eminent, in the days when the Republicans weren't Trumpoid. Okay. And they came up with a scheme which actually would achieve the emissions reductions under the Paris Agreement. And I think this is brilliant because they're on the Republican side. And therefore, they're much more likely to get traction than if Bernie Sanders or somebody suggested it. So why not really go with this and constantly bang on about carbon taxes and the brilliant Republican idea about Baker-Shultz tax? I just think you've got to get your wins, and sometimes it's your political opponents, if I'm assuming that most of you here are Democrat, but maybe not, or Nader-esque, or who's on the who are the? Is there anyone left of?
Well, Jill Stein, which counts, Bernie is it.
Okay, Bernie's it. All right. Okay, right. So why have I got that? I've done that one. Now, number 11, stocks and flows. I think I said this yesterday. And I really like this because it's the definition of sustainability is then meeting the needs of the present without compromising the future. This is a really interesting economist who I think might win a Nobel Prize called Sympathy Dasgupta, who I said yesterday, I'll whiz over this, talked about the 5 stocks that comprise wealth. And he said wealth is not GDP. Gross domestic product is just a flow at any one time, but a series of stocks. So you've got manufactured capital, most countries gone up. Human capital, most countries gone up. Knowledge, sort of gone up. Institutions, I'm not so sure about. That's another big issue. But democracy has spread, but it's anocracy in many places. But if you damage your natural capital and destroy that, you will undo everything. So, and he says the consumption-environment relationship is not self-correcting unless there's concerted action at many levels. And that's what's not happening. So we're on a track for not good outcomes. And that's why I slightly disagree with Bill Gates when he says everything's getting better. He is right if you just look at human capital. But if you look at the whole gestalt of wealth, I don't think he is quite right. And I think actually he would probably agree because he is investing very heavily in zero carbon options and research to improve many of those things. What about flow structures? This is number 10, transport and age issues. Now, for good healthcare, we need drugs, supplies, staff and patients all to come together in hospitals, right? Well, or wrong. You know, there's a cost, we were having a conversation about this earlier, you know, the costs of drug procurement in carbon is high, transport costs for staff, drugs and the like. Patients would rather be treated locally, particularly for primary care issues. We've got big problems in hospitals of antimicrobial resistance, which a Goldman Sachs economist came up with a figure of $10 trillion worldwide affecting us in about 30 years' time. And we've got old people much more vulnerable to everything, so shouldn't we keep them at home? So there are those kinds of issues. And then there's a lot of talk about redesigning value health systems. And by value, we mean outcomes over costs, okay? And I dug out this, New England Journal of Medicine Catalyst, which is a kind of blog, what's standing in the way of care redesign, and American physicians were interviewed, okay? And this is what they said. What are the barriers to improving value of care? This is just talking about value rather than sustainability. And they said the fee-for-service payment system, because that incentivizes you to do more things rather than trying to get health outcomes. We don't have that. In the National Health Service, I've only ever, in my entire career, seen 3 private patients, and I'm so far down by $25. Okay, I never made any money. And one of them, I said no to, I couldn't be bothered to fill in the forms. And another time, a woman came from Tanzania with her daughter because her son had died the previous year. And her daughter was completely normal, but I spent an hour reassuring her. And then at the end, she said, how much will that be? And I said, don't be ridiculous. This is the National Health Service. No problem at all. And she went out. And then the administrator came and said, was that a private patient? I said, no, $25 for use of the room. Anyway, but that's a different system. But we do have lack of patient engagement. We have lack of integration of different types of facilities. The way we organize our healthcare is very, very important, and there's lots of work going on in all of that. And there have been some great work done, actually, in quality of care. You've been actually a lot of the world leaders, Don Berwick and IHI and all of these people, and the quality chasm that was published by the Institute of Medicine about 20 years ago. And actually there is a Lancet Commission coming out on quality of care that's chaired by Margaret Crook, who works at that polytechnic about 100 miles from here, that little Harvard? Right. Now, what can we do about delays in relative to the rate of system change? So we're in deep trouble. We've got, you know, in fact, when we did the first commission, there was a guy in our meteorological department who'd written a book saying 7 years to save the planet. And that was in 2007, and we haven't done it. So he would argue that we're stuffed, but we can't say that. So I just want to I'll make reference to just a couple of things. First, I showed this yesterday, which is from our countdown, the climate resilience health infrastructure. Dark blue is where some efforts have been made, but not adequately. The light blue is absolutely nothing being done, and the grey is we just don't know. And so this is embarrassing. You know, we've known about this for 20 years. Where's all that aid dollar going in terms of things like solar panels, solar refrigerators, all kinds of hydropower, all kinds of imaginative stuff, which would be economically good for this country and aid donors, as well as sustainable? We're not doing it on anything like the scale we could. And the amounts of money going into aid are derisory next to expenditure on military and research. You know, we're insane, actually. But anyway. And then I like this. You've got to make it a bit more chic. So I really like this, biophilia. This is a word of Edward Wilson, the great biologist who I'm a big fan of. Was he at Yale? No, somewhere else. Not at Harvard. Oh, God. Anyway, the idea of making things green. Now, we can all do that. I bet you could go back to whatever clinic you're in and spice it up a bit and make it nice. And in India, they put lots of stuff around now because it cleans the air, because the air's filthy. The only thing there is I would turn the bed round so that they could actually see it. But anyway, that's a small point, but worth remembering. But there's loads of stuff. There's all these journals in architecture about how to green things up and water fountains. And it really matters. It really makes a difference. Architecture is incredibly important. And you can do all kinds of things. And the more greenery you can stuff into places, and of course expanding that into urban farming and roofs made of grass and thyme. Why can't we do this? And it's healthy and it makes you feel in contact, because we are biologically programmed to love being part of nature. Gardening is incredibly therapeutic. My son's training as a psychiatrist, and he's trying to build a garden in one of the hospitals in London because he's a mad gardener for some reason. And he says it's going to be very therapeutic, and there's lots of evidence now that gardening does that. Right, aviation. Now, when I talk to young people, and I'm the same, I'll do anything to be sustainable and right on, but giving up flying is really difficult. And I have a terrible carbon footprint, and most young people don't want to do that. But there are moves afoot. This is the next generation zero carbon. It only flies 100 kilometers, you know. You wouldn't even reach Harvard. But having said that, I think that's where I would invest a lot, because I think basically human beings are inquisitive. They want to travel. They want to see the world. Let's focus. It's not a massive contribution, aviation, but it is big. And I think it would be psychologically really important to do that, along with electric cars. Now, if we're going to be active, you've got to take power. And this is, just in case you're not thinking of mobilising, a women's suffrage group in 1892 in Australia. And they got together women, and they fought a 30-year battle to get the vote in different places. In Switzerland, do you know when women got the vote in Switzerland? Have a guess.
1970s?
1971. Anyway, I'm just about, now that I've retired, well, I haven't quite retired, I'm going back to UCL, but I've got an interim here. I'm starting a blog and a podcast. So I've got my blog up and running, and so I'm interviewing like crazy people, you know, and I'll probably interview some of you. I have already. And this is my 95-year-old aunt, who was brought up like all of us as a strict Catholic, and then at 25 became an atheist, a humanist, a feminist, an anarchist, and a writer all her life. And so I thought I'd go and interview her. And it is amazing because she worked with Bertrand Russell, and she helped to found the Campaign for Nuclear Disarmament. She wrote a book 40 years ago about voluntary euthanasia. She ran the National Secular Society. She left school at 16, and she had she said, I'm unencumbered by a university education. And she's like a total rebel, and she's still campaigning again. She wrote a letter to an American journal last year arguing that Stephen Hawking had got it all wrong on time, which I thought was quite impressive, really. Anyway, ownership. Why am I talking about this? Ownership is very important. So giving people greater ownership of health facilities and getting people involved in making them more green and all the rest of it is important. Having committees like this in Australia. This is a committee that was used to consider whether a health service was good quality care. It's a shame that the Australians are a little bit old-fashioned in their dress, but I think this was probably taken about 5 years ago. So, so social accountability is crucial to all of this. I'm going to skip over this. Right. Positive feedback loops. I think we need to encourage the consumer sector to do good things. So, and I think we need to encourage wealthy institutions like Yale University, which has an endowment of a moderately sized low-income country, $28 billion. I'll repeat that, $28 billion, to divest from fossil fuels. And if you think I'm slagging your institution off, my institution, UCL, is also not divested, and we've had big punch-ups. And this is interesting. Check out, if you have any shares, Carbon Disclosure Project monitors companies for how green they are. And they come up with scores like this, so that a good company is Tesco, the supermarket, which got an A score, and Tullow Oil got a D, and British Aerospace Systems that makes, you know, weapons for the Saudis to bomb Yemen, got an E. So on 2 counts, they should be shot. And it makes a difference. And so green investing is a big new industry, and we need to encourage it. I'll skip that, and all about, well, it's all linked. Good behaviour around hygiene, which is a total disaster in most of the world, and the impacts on antimicrobial resistance. Another issue, but we haven't got time. Incentives. You're going to hear, no, you're not going to hear, but there is a thing called the NHS Sustainability Unit, and a guy that led it until about a month ago was David Pension. And so this is unusual to have somebody in charge of a nationalised system like the NHS in Britain. And he has put in a whole load of measures against resistance and apathy, of course, to redefine how we run health systems to make them more carbon-friendly, more health-orientated. And if you look it up, actually, go online and look at the NHS Sustainability Unit. There's all kinds of things you can do in the community around. This is a bus stop telling people how many calories they would expend if they actually walked to the next bus stop. I know, of course, you don't have buses in the United States. You only have cars, and therefore this doesn't apply to you. But anyway, no, it does. And of course, I'm hearing great things in California and many other states about redesigning urban centres. Social media, information flows. Okay, so has anyone seen Blue Planet, the latest series? People nodding, from David Attenborough, yeah? Brilliant, wasn't it? All the killing. I love it. Yeah, sorry, it's very right on, but you know, basically whales eating seals and all the rest of it. But then at the last, he showed all of this, the plastic in the oceans. And at the end, I mean, he is a great man. He should be our president, if we had a president and if we had a constitution. But we don't. I'm a subject. I'm not a citizen. Anyway, so David Attenborough at the end said, why are we sticking all this plastic into the oceans? And if you ever wanted to meet, there has been an absolute outcry. Everybody is, look, my wife immediately bought me one of these, said, because I only drink water and I love, you know, Perrier and all that stuff. Never again, so I have to fill up the tap and all this. But it's very nice, and it just stops you. And actually, it is a big issue, and I think you'll find that plastic use in the UK is going to fall, and a lot of companies are going to have to change their behaviour. And I just wondered if it would have some kind of influence on the Americans. Is that possible? It's possible. Okay. Now, power to self-organise. This is my big passion, and I'm going to skip over this quite quickly. This is in Bolivia, where women's groups were used to mobilise people around maternity care, and I heard about this because we'd done a trial telling people what to do in Nepal, and it had no impact whatsoever, because it doesn't. If you tell your patients what to do, there are no trials that really show that it makes any difference, okay? They ignore you, or they forget. So we did this, and we said, well, we need to do this somewhere else, and we decided to do it in Nepal. This is actually a picture from Bangladesh, but nonetheless, we also did it there. And just to fill you in, there's a cultural anthropologist called Robin Dunbar who says basically humans don't meet in random. You have your survival clique, your family, who are going to look after you when you're very little and very old. Then you have your sympathy groups, which is the next social grouping beyond the family. Then you have your affinity band, which is where families as hunter-gatherers would come together to sleep in the cave. And then the limits of your social brain is the Dunbar number of 150, your Christmas card list, your small village. You can't remember. You can remember, but you don't really know more than about 150 people, even if you're on Facebook. And Cambridge Analytica have got hold of it. So I didn't know about this at the time we did it, but we've done lots of stuff on peer pressure and using sympathy groups. And we did it in Nepal, and we showed a very big impact on neonatal mortality rates using a cluster randomized design. So the blue was control, the red was intervention areas, and you may say, well, did the women's groups in the red interfere with the blue? And the answer is no. God designed Nepal for cluster randomized trials. The yellow are either 15,000-foot mountains or raging rivers, so no contamination was possible. And it was fantastic. And we showed a big impact. And no one believed us. We published this. So basically, it's a community action cycle where women have a few meetings to discuss their problems, plan their strategies, put them into practice, evaluate, and come back. And this is a model that could be used for all kinds of outcomes. It doesn't just have to be women. We did it again in India, and we showed an equally big reduction in neonatal mortality. So we realized it wasn't a mistake. We showed that it had plausibility, that there was a delay before the improvement in mortality or survival kicked in. We did it in one area of Bangladesh, a big study, 500,000 population, where it didn't work, and we got the dose wrong. So it's like a drug, you have to get the dose right, and we went back and repeated the study for 3 more years, and we got the dose right, and it had a big impact on mortality. So this is great. And then we found this woman, bottom left, Arti Ahuja, who was Secretary of Health for Orissa State. She said, I really like this. I'm going to scale it up. And she put in practice 140,000 women's groups covering her population of nearly 50 million. And now the Ministry of Health in Delhi has ordered 8 states to implement this, and it's being scaled up. So you can take things to scale if you can convince people that they work and they seem plausible. In Greece, sympathy groups invented modern philosophy with dissolute men sitting around discussing philosophy before they embarked on orgies. This is Siena, social hospital in 1440. Go and see these murals in Siena. There's on the left, there's a guy doing a urine test. There's a surgeon doing some work. There's the hospital committee in the middle. There's end-of-life care on the right by an oblate friar. And in the other mural on the left is a women's group wet nursing orphans, orphan babies that have been abandoned. And on the right, there is the betrothal of an abandoned girl who has grown up in the hospital grounds to reintegrate her into society. The social hospital. I'm sure it's like that in New Haven Hospital, where they betroth people. And if you're not betrothed, I'm sure they would arrange it for you. But I think we need to rediscover the social hospital. And of course, in coffee houses in London was the source of innovation. Alexis de Tocqueville came and really analysed this French guy who pitched up and saw what America was all about. The American dream is nothing to do with individuals. It was all about small groups coming together and working like crazy, your Protestant ethic of your forebears. That's the American dream. This is Duke Ellington, greatest museum of the 20th century, who I saw twice in London before he died. Barcelona is a sports club. Theatre is classic Sympathy group. You have your enabler, the director. Who's that director? No, it's not Martin Scorsese. No, it's Peter Brook, who was one of the great theatrical directors in a classic Sympathy group of, and this Sympathy groups have such power that they're used by terrorists. These were the people that blew up, 15 people blew up the Twin Towers, and this is another Sympathy group, the Navy SEALs that went and got Osama bin Laden. And this is another Sympathy group. All politicians have it. I haven't got Trump's Sympathy group up, but he has one. I've got a list of them. This is Putin. All politicians have it. And I've got a book coming out, so I'm pushing this, but I think it's very relevant to climate change, the bottom bullet, second bullet, because I think there are so many 21st century problems where we have to recapture social interventions and cooperation. Now, this is my brother. He is an American. He's been here for 47 years. He left school with no qualifications. He arrived in New York, was in an advertising agency, and he ended up, this is the dream of America, as corporate marketing chief at General Electric. And he made squillions. And he lives in Norwalk, Connecticut. And I hadn't seen him for 2 years, so I went to see him 3 days ago. I said, "Hi, Richard." And he was in his big SUV. And he said, "Yeah, we got 4 SUVs for the 2 kids and for, anyway, his wife." And he's a Republican. Can you believe this? And but he didn't vote. He actually voted for Hillary, which is interesting. But anyway, he said, "What are you doing here?" I said, "I'm going to Yale University to give talks on climate change." I said, "What do you think of climate change?" He said, "It's not going to affect me. And you bleeding heart liberals, you're not going to change the system. This is capitalist system, and so it was great because I'd arrived here, and within minutes I had a sort of redneck telling me off, and so it was really great. Fortunately, Linda, his wife, is a Democrat and really passionate about all these things and would approve, So, but it's very interesting because we have big arguments. But anyway, never mind. I'll skip this because we're running over time. Yeah. Let's stop. Finally, changing the mindset. We managed it with smoking. I would never have believed that you could change smoking in restaurants and pubs in the UK, and it happened after they introduced it in Ireland. Big impact on respiratory illness. You can bring about change. This is the Director General of WHO, Tedros, and he talks all the time about changing mindsets. He's quite an interesting guy, actually. I went to see him the day I left, and I didn't have a tie on, and so he lent me one, and then he said, "Keep it." So I put it on eBay, and nobody's bought it yet, but anyway, no. I'm going to say this, corruption in health, mindsets. We don't talk about corruption. Bribe for everything. This is Bangladesh. This is Malawi, where there's a massive scam in the Treasury. A massive scam in Kenya, where they stole $50 million from the maternal health budget. Massive scam where the minister in Rwanda was fired. Medical Council of India, largely responsible for corruption in healthcare in India. In the UK, it costs £7 billion per year. That's $10 billion almost. But this is interesting. I found this 2 days ago because I follow Nepali politics. I've been going to Nepal for 30 years, and for the last 15 years, you have power cuts the whole time. And they've just done an investigation, and they found out that actually it was all corruption. All of it was corruption, that the head of the authority was flogging all the electricity to particular companies and not saving it for the population. A disaster. The impact on the economy, on people, disastrous. They changed this guy, and now they've got electricity all the year round. Unbelievable, the impacts of corruption, and we have to do, and that's the problem going to be with all the rest of it. How are we going to transcend paradigms? I think we go for young people. Young people are absolutely lovely. They have white teeth. Well, not all the time. And I'll skip that and all of this. Just to say, 1968, when I was not even a student at university, there was a big change. 68 was a very pivotal year. 79 was the onset of neoliberalism. I think 2016 was a pivotal year with the change towards taking back control and nationalism, which is dominated by the right, but also has a left-wing component as well. And I think you guys are really important. So I'm very keen that you should subvert the system. I had a picture, I seem to have lost it, on Yale divestment and the people that got arrested in 2015, 17 students. Civil disobedience is something we need to think about. Gandhi did it, campaign for nuclear disarmament. These things take a long time, but we must be prepared to do it. That's my Twitter, that's my blog, that's the book that's coming out in a few months' time, and I hope I can interview you later. I'm sorry I've overrun.
Okay, so people want to take some time for some questions. I think, if you need to leave, feel free to leave, but are there any questions or comments?
What do you envision as being the social hospital of the 21st century?
No, I'm not. I would rather say that the way we link the health system to social care. So, for example, in the UK, they are finally, after about 15 years, going to link social care with healthcare. So, if you look, half of 75-year-olds in the United States are lonely, and lonely people get depressed, and they get sick, and their long-term conditions get worse, and it's a huge effect. And so social care is absolutely linked to healthcare. And so I think restoring that link and also thinking about social interventions around tackling loneliness, long-term conditions, quality of care and the like is very important. So it's not betrothing people in the hospital necessarily. But do you get my point that restoring the social dimension to health, I think, is very important. We're not just about the Hoxpox gene in some, rare condition.
Any other comments?
I wanted to go back to the smoking. So towards the end, you talked about massive changes in the prevalence of tobacco use, driven by social policy. But I mean, to me, it sort of all started with taxation, right? The public perception around and willingness to smoke started with tobacco taxes. So I was just trying to link that back to the carbon tax and I mean, can you maybe speak to what do you see as the main barriers? I mean, you started your top 12 with the carbon tax, which you said would be enough to...
No, I'm using Donella Meadows' thing, and I'm not sure she's right there because most economists would argue that taxation is fundamental.
Yeah. So what are the barriers to carbon tax? I mean, they're probably vastly different depending on the country, but...
I think so. Firstly, it's an antipathy towards tax, and we don't sell it in the right way. Because I'd always thought, another tax. But actually, if you say we're going to slash your income tax and replace it, then that's fine. You'll then get interest groups against it. So your current government would not, I think, go along with carbon taxes. And then you've got the issue as if the United States is not there or certain major blocks, it's not going to work so well because you've got a multinational. And then you've got the compliance thing. And back to corruption. Is anybody going to stick to this? Can we really measure emissions in a very meaningful sense by geographical boundary? There's all these kinds of issues around it. But in theory, the economists tell me that it should still be able to work if you have political will.
Yeah. I mean, it's fascinating because, there were some green states within that map of carbon taxes, including California, which is like the fourth biggest economy in
Yeah.
the world. So there's,
Do they have a carbon tax?
well, according to.
They must do,
They
yeah.
have a cap and grade.
Right.
I mean, point being that,
Yeah.
there's more and more talk now in, at least in this country, about the influence that states, the state and local level.
Absolutely.
have massive.
No, I didn't emphasize that enough. I think that's absolutely true, that states and cities particularly have much more power. You don't have to be as depressed as you might be about what's happening at a federal level. Centralized politicians don't have as much impact as you think. And I remember Bill Clinton saying this at a conference in Sweden, saying Republican mayors get it because they have to pay the insurance bills on their, and on properties and the future, and they know about sea level rise and all the rest. So you're absolutely right. And maybe you'll reach a tipping point with carbon taxes as people begin to realize. The problem is that in the current climate, it's difficult. But I think Macron might make a difference. He's mates with Donald Trump, isn't he? They're big friends now, which was, for now, yeah.
I had a question about, so in terms of the number one, the paradigm change, shift
Yeah.
paradigms. So what do you think, let's say take making healthcare more sustainable. Is there a particular paradigm shift that would do the most towards accomplishing that?
Well, just going back before I answer that, the key question for a big paradigm shift is whether I'm right or my brother's right. And I think my brother is probably right, because he says we're living in a capitalist neoliberal system, and we're not going to change that. You're a bleeding heart liberal. And now, I don't think that's entirely true, because I think things do change over time. And sometimes you get a tipping point and things change quite quickly. And, a broader issue is, if you go back to hunter-gatherer societies, they were what was called immediate return societies, and we're delayed return societies. So immediate return, hunter-gatherers have an absolute primary role for sharing. If you hunt meat, you share it with everyone. If you gather, you share. Sharing it's absolutely taboo to be individualistic. You are evicted if you become. Whereas we're the complete opposite. And the question is, can we build into our societies or our politics more sharing? And I'll just say one thing about Switzerland, having slagged them off. Switzerland has socialised housing, rent controls, nationalised railways, nationalised post office for all your bills, a nationalised education system with heavy investment in vocational training, and it's totally decentralised. I would challenge anybody here to tell me any Swiss politician, because nobody knows, not even in Switzerland, who the president or prime minister is, because they're not really important. It's all decentralised to cantons and communes. It's a consociational republic, I've been told. And it's the most popular government in Europe, and it's the most productive economy in the world. And Swiss like being Swiss and living there. And I liked living there, Okay, they do have $10 trillion of black money going through their economy each year. Yeah, that is a small confounding variable. But nonetheless, it is possible to have a different approach to adversarial politics. So in Britain, we're always screaming at one another, and it's very entertaining, and likewise in Congress with Democrats and Republicans. But it's become incredibly dysfunctional to solve global problems. So somehow we've got to break that down and try and build it up again. And it could take a long time.
So what you were getting at in the beginning, though, is that you're saying the paradigm shift of shifting from a capitalist-based, let's say, to a socialist-based economy.
Well,
kind of out of the question.
I think that's very provocative, you see. I think saying, capitalism, Marx had said that capitalism is great for, you know, being innovative and coming up with new products and all the rest of it. But it's the way you run it. And Switzerland, in social terms, is to the left of Jeremy Corbyn and Bernie Sanders, way to the left. But they manage, and it's popular, and they still have a capitalist economy.
How are they doing on greenhouse gas?
Not bad. I mean, they're pretty, I mean, you know, is anyone doing really well on it? But they are, they pay a lot of attention to sustainability, to sustainable food systems, to local procurement. And again, decentralization, I think, is a very key issue. And it's back to the point that was made over here about states and local and taking back control, which should not be the prerogative of the Tea Party. I think it's a much more generic thing for political systems.
So the point is, if we're going to take kind of replacing capitalism off the table for now.
Well, a sharing cooperative model that incorporates capitalistic issues would be fine if we can get our carbon also under control by a mixture of technological and social means. Because I think if you say, you know, if you come in and say, well, look, you've basically got to go communist, I don't think that will fly in America or in Britain, actually. And I don't believe it either, because the communists were as bad on emissions as, you know, and pollution.
But sorry.
Well, I would just chime in that the revolutionaries say that you build the new in the shell of the old, and basically you make the old irrelevant. That you don't replace something by attacking it directly. And so the work that you're doing on the groups, Peter Senge talks about other systems.
Yes.
That other institute.
Yeah, the fifth dimension or something. The fifth.
Yeah.
Yeah.
I'll get there. But he says people don't resist change, but they resist being changed.
Yeah, exactly.
And so, you know, that challenge of that so much of what we've done in the world with good intentions has been about helping, which in some ways is actually has lessened people's capacity.
Yeah.
And what you're looking at is how do we completely flip that to say, actually, I don't have any answers for you. I'm not here to fix your problems, but I'm here to support you as you figure out how to fix it.
Yeah. Have you seen that Robert Reich documentary called Saving Capitalism?
No.
So Robert Reich was Clinton's Labor Secretary, and he fundamentally disagreed with a lot of the Clinton policies, and particularly his finance secretary, Robert Rubin, and they fell out, and eventually he went. But he's agonizing now that he missed an opportunity to change things. And the most impressive bit of it was he went round and he finally met up with a very conservative Republican called Charles Klatt or something. I can't remember his name. But he is a real kind of Tea Party guy. But they both agreed that fundamentally they're against crony capitalism. They're against these massive institutions that tax evade and cream off money. They want to go back to a system whereby people feel that if you work hard, you'll get on, the traditional American dream. And they actually share a lot of those, right and left can share a lot of similar ideas. And I think that decentralization model, people feeling in control, which I think was a major reason we voted for Brexit, because people saw Brussels as this kind of out of control somewhere else, bunch of Belgians, you know. And I think there's deep in us this feeling that we want to have a bit of control over our lives.
So I think probably we should end the formal discussion here. And thank Dr. Costello again.
Did that work? Oh, am I?
Yeah.
For the recording.